Hello, welcome everybody to the panel discussion on COVID-19 and the Wikimedia community. I am very excited to introduce Iñaki, Kimberli, Netha, and Subhashish to all of you. And just to say a few words about the background to how this talk came to be, because it's quite a special story for us. We put the call for proposals for this conference back in February. This was before the lockdown happened. But as the craziness started in the world, we extended the call for proposals for end of April, when we decided that we're going to be online. And during that time, we got two separate proposals to talk about COVID and languages. And we asked the speakers whether they would be happy to combine the talks. And in that process, we also invited a few extra people in. And so this is how this talk came to be. It's a panel presentation, and it's the longest session in the whole conference, but we felt it important to give it time because there's so much interesting things to share about the topic. This talk, I think it's both important in this moment, but it's also points, I think, to many general issues that some language communities face, just in processing information and how they can respond quickly to what's happening in the world. The pandemic crisis has enabled a rise in activity on the internet, creating different media, descriptions, guidelines, but all of those are mostly distributed in main or official languages. And so the question is, how have other languages reacted to it? Is it harder for them to keep up, or maybe there's actually some opportunities that such a situation creates for them? And we'll talk about all of this in this panel. Each panelist will have some time to present their own topic, but we will also have a fair bit of time at the end for a question and answer session. So please, as you listen to the different talks, gather your questions, put them in the Etherpad for this session or in the YouTube comments, and we'll take all of the questions and hopefully have a very interesting discussion once all the speakers have finished with their talks. And with all of this, I'm very excited to hand over to the panel.
Thank you, Daria, and thank you so much for hosting us. I hope everyone is keeping safe while watching this panel discussion. As Daria already has introduced, this is about the Wikimedia communities around the world, particularly the few communities that we are all representing here, and how we are coping up with COVID-19 and are contributing to our respective Wikimedia projects. My name is Subhashish, and with me in this panel, I have three more co-panelists, and I'll introduce them very quickly. The first one would be Iñaki. Iñaki is from the Basque language Wikipedia. And the next would be Kimberli, and Kimberli represents the Northern Sami language Wikipedia. And then there'll be me to go next in the panel discussion, and then it'll be Netha Hussain, who is from the Malayalam language Wikipedia community in India. And this picture that you see right now was clicked by me at the Wikimania 2018 in Stockholm, where some of us gathered, well, unfortunately, mostly male in this picture, but now the community has grown up a little bit. And back then, there were only a few of us who were very interested about marginalized languages and less represented languages, and we want to discuss and how we can bring those languages on Wikimedia projects. So then started a chat group, and then we've been collaborating. And this panel discussion sort of is something that Kimberli started. She proposed the idea, and then she invited some of us, and we thought it would be a good idea to represent the diversity that we have in the Wikimedia community. So with that, I would hand over the mic to Iñaki, and Iñaki would be talking about the initiatives at the Basque language Wikipedia community that he and other friends are leading. Over to you, Iñaki.
Thank you, Subhashish. Yeah, so my name is Iñaki LL, Iñaki Lopez de Luzuriaga, standing for Iñaki Lopez de Luzuriaga. I'm from the Basque Wikimedians user group. And yes, I will be talking about the circumstances arising after the state of alarm was declared in Spain, and the confinement in both Spain and France. So I would, can I see please the next slide? Thank you. So just for a bit of contextualization, our situation is of the language community it is lying in 3 different administrative units in France and Spain. And so we had different messages coming to us that most of the times it was in France and in French and Spanish. So when we were confined, we started to get confused about what to do, what we should do, what the rules were. Yes, everybody could understand what was coming in French and Spanish, because nowadays the situation is that 100% of the population can understand and speak, I would say, also Spanish and French. But we needed, especially for the education community, the smaller, the children, the elderly, and for those who are living in Basque, just that, we needed the messages as well coming in Basque, and everything that was coming from the social media, also in order to feed the Wikipedia, we needed messages that about guidelines, but the descriptions as well of the situation on the street that was coming in Basque. And since it was an emergency situation, everything was done first hand in Spanish or French, even on the Basque Autonomous Community, which is on the western side in the map. I don't know if we can see here very well, but it's on the western part. There is the Basque Autonomous Community, and its government acknowledges Basque as an official language. But everything was coming very late and very clumsy, so it was necessary to do something for ourselves. If I can see the next, yeah, thank you. So we can see here a bit of the map of the Basque speaking density. On the right-hand side, we can see the density population that is speaking Basque. And on the left-hand side, yes, we have the status of the Basque language as official. Actually, it is like that, but just officially or theoretically, sometimes it does not even get to be implemented, that officiality. So if I may say, I may see the next slide, please. Yes, thank you. So we were relying a lot on free commons licensing. And for that, we just took advantage of some agreements that we reached at the beginning of this year, last year, with some media outlets, especially local media outlets. We managed for them to have their stored multimedia files and even text as well, have it in commons license. So we could be using them in order to feed the Wikipedia and even to share and distribute by the social media these messages also in Basque. So it came basically from Berria, which is the newspaper in Basque, the only newspaper in Basque, also from the Basque government, which has got a website with free license, and the local media. You can see a map of the local media writing and publishing in Basque. So there are not many places, but there are some places that have a news. It's actually a magazine, a weekly magazine, written and published in Basque. So yeah. May I see the next slide? Yeah, so we were just transferring some data. For example, here we can see a very nice woman giving out some guidelines as to how to protect against the COVID-19. It was in a local weekly media outlet, but so this distribution was almost very just for the local community, but we took it to the Wikimedia Commons and started to distribute it as well by means of the social media. So we can see there that we transferred it. That was very helpful to take it to the Wikimedia Commons for local media outlets. This network of local media, they are called Tokicom. So it's local media or something like this. Yeah, may I see the next slide? Yeah, and so we saw an opportunity as well in a project that was actually started by Kimberli. Thanks, Kimberli. That was a great effort you made there, and we saw the opportunity to by collaborating and by translation to put many graphics in the Basque language. The rules are sometimes different, but are basically the same because they are relying on medical research and for the whole world globally. And so we prepared this page basically by Kimberli herself, and we started to translate graphics to our language, in this case Basque language. So may I see the next slide? And so we found that there are two topics that I have dealt with here, and there are there are downsides and bright sides to it, of course. And on the one side, those files that were had no SVG extensions, like PNG, were difficult to edit and to translate. That is what we found. So we relied most of the time on SVG files. There were some licensing issues that were not totally common to free licensing. And we also found a need for remote volunteering. I mean, web-based. It was necessary as well a bit more automatization, because it is difficult to work together remotely, and some things were pretty how would I say, clumsy. Until you do not see the last outcome of the graphic, you won't see if a translation is totally right, etc. And on the bright side, the networking opportunities arising from this situation by means of automatization, as much as there is the opportunity to do that, and with volunteers from many from different minority languages, relying sometimes on a large language, main language, like in this case English. The expansion of commons licensing in the speaking the language community can be very beneficial in order to spread the language just by means of this collaboration, take this material and bring it over to the internet and to the Wikipedia. So that these are the downsides and bright sides we found on the way, and arising from the special situation in the COVID-19 pandemic. And I think that was all. So I think we can, later speak more about this. And now, Kimberli, you can dwell more on this.
Over to you, Kim.
Sorry. Actually, Iñaki, I can't take credit for it. The page was started by Susan Ones,
Okay.
who was my partner in the hackathon.
Sorry.
Yeah, no problem. Tervepukit, mulla on Kimberli Mäkäräinen, Wikimedia Lädjänmästä, the Wikimedia Taarasta. So, hi everyone. My name is Kimberli Mäkäräinen. I'm from Wikimedia Finland and Wikimedia Norway. I'm a translator and terminologist in real life. In this portion, I'll discuss how speakers of minority languages are excluded from receiving information about things like the COVID-19 pandemic in their own mother tongue, than what we did for the minority languages spoken in Finland during a hackathon weekend in March. I'll only briefly touch on what the various Wikimedia COVID-19 projects have done, since Netha will be talking about them later on. I'll close with the results and some thoughts about what we as Wikimedians could do to prepare for any future epidemics or pandemics so that we could get this type of critical information out there faster and more efficiently. Next slide, please. So this is actually Nav's query from last year's Celtic Knot conference. And it's a map of UNESCO's endangered languages by status according to Wikidata. The orange dots on the maps are languages considered safe by UNESCO. These are languages that are not necessarily going to be high priority for crowdsourcing translations during a pandemic, since government agencies will automatically provide material in these languages. So in Iñaki's case, Spanish and French. Nor do we have to translate material into the languages represented by the pink dots. There's no one left to understand it if we do. But the languages behind many of the other dots, their speakers are not being told that there's a pandemic going on, or even how to protect themselves from it in their own language. This was our starting point in March of this year. Next slide, please. So, Susanna Ones from Wikimedia Finland, and I couldn't ourselves, but we could concentrate on trying to make sure that the minority language speakers of Finland were informed about the pandemic. We're going to be participating as a team together in the Crisis Hackathon in Finland. So this became our project, which evolved into 2 COVID-19 wiki projects, which Netha will talk about later on. When we started, material had been created in Finland's 2 national languages of Finnish and Swedish. In addition, material had been prepared in English, perhaps because of the erroneous belief that everyone else understands English. Nothing had been created in or translated into any of the Sami languages, Finnish, Romani, Somali, Estonian, etc. While many people also know Finnish and or Swedish to various degrees, it's vital that everyone understands what's going on and what they need to do during this pandemic to ensure their safety and that of their family and friends. For this reason, we decided to make sure this information was available in their mother tongues too. To keep translating and terminology issues to a minimum, we concentrate on infographics, particularly those created by Susie Wiles and Toby Morris of the spin-off in New Zealand, who also ensured that the infographics were translated into Maori, for which we're very thankful. Next slide, please. So Finland, we decided to split them into 2 different language groups. Here we have a set of minority languages that are not widely used outside of Finland's borders. As such, we couldn't count on other countries to translate material into these languages. Many of these languages have few speakers compared to Finnish or Swedish, which means that they're not necessarily high priority for governmental agencies either. Next slide, please. So being wiki nerds, we of course turned to Wikipedia to find out what were the most spoken languages in Finland at the end of 2019, other than Finnish, Swedish, and English, since material had already been prepared in these languages. So we were left with Russian, Estonian, Arabic, Somali, Kurdish, Farsi, Chinese, Albanian, Vietnamese, Thai, Turkish, Spanish, and German. Statistics in Finland do not often differentiate between Sorani and Kurmanji, but we did in this project. So this gave us a total of 14 more languages to work with, and only 2 people at the start. So this is a really diverse group of speakers. Some have been here for decades and are completely fluent in Finnish and or Swedish, but there's also a sizable population of speakers who have been in Finland for only a year or two, and they haven't had enough time to learn these languages and necessary to a degree that they would actually be able to understand everything about the pandemic. And since it's crucial that everything is understood and that the information being disseminated is up to date and reliable, we decided to start translating into these languages too. At the same time of the hackathon, the Finnish broadcasting company Yle decided to start publishing information in Arabic, Somali, Kurdish, and Farsi, also because this information wasn't available. And part of what was being spread through social media was not actually correct either. So next slide, please. So is this doable or is it a disaster waiting to happen? Faced with this list of languages and knowing that we only had a weekend in which to translate or find people to translate our infographics, we got cracking. It quickly became apparent that of the first 8 languages on the list, only the 3 Sami languages would get translated that weekend. Of the other languages, of the 14 that were left, then the ones in bold are the languages the infographics were actually translated into during that weekend. Somali only had 2 sentences translated because we reused them from previous medical posters from the diaspora. So that's why it's in cursive. So 11 languages. Actually, but we had 4 bonus languages added during the weekend since people could add their own languages to our spreadsheet. So after the weekend, we ended up with a ton of new minority languages like Louisiana Creole, thanks to information about being able to translate the infographics into your own language, having spread across social media. Next slide, please. So why do we consider the Sami language is important enough to translate these infographics into? Skolt Sami has about 300 to 400 speakers, Inari Sami about the same amount, and Northern Sami 15 to 25,000 people. Well, the first confirmed case of COVID-19 in Finland was a tourist in Ivalo in the north of Finland on January 29th, 2020. By February 7th, the Northern Sami Wikipedia had an article on the pandemic and was one of the first sites to have its information in Northern Sami. Norway's first confirmed case was also in the Sami-speaking areas in Tromsø in late February. And right now, the Sami-speaking areas of northern Sweden are hard hit by the pandemic. Although we no longer are top on the list of results when someone Googles how not to get COVID-19 in Northern Sami, we're still ranked second, only being displaced by the joint website for all of Norway's health authorities. Next slide, please. So this is one of the infographics that Iñaki was talking about, and this has been translated into multiple languages. We also localized it. So instead of talking about not going to barbecues, we talked about not going to ski centers, which was a big important thing that people started doing in Finland when they heard the pandemic was coming. They started heading for the ski centers. They can go on vacation, taking the virus with them. So our derivative work of the spin-off's animation on the importance of social distancing and containing the virus went, and I'm sorry for the pun, viral for us on Facebook, reaching around 8% of Northern Sami speakers on that platform alone. Next slide, please. So right now, Wikimedians have translated 9 spin-off animations into about 30 languages. Unlike a lot of governmental material about the pandemic, these files are small and the infographics are easy to understand, which means that they're also being spread in mobile phone apps to people who might not necessarily come across them otherwise. This is also fighting the misinformation and disinformation about the pandemic in certain communities. So next slide, please. In the COVID-19 guidelines by language category, we currently have 94 languages. So 94 different categories for 94 different languages. And we actually are missing Sorani and Kurmanji because they're still waiting to be categorized. But the material exists in Sorani and Kurmanji. And this is thanks to the COVID-19 Translation Task Force and the government agencies who released their material under a license we could use. Next slide, please. So as can be gathered, it wasn't an easy go, and we came across lots of unexpected issues, some of which Iñaki has talked about, incompatible licensing in difficult formats. And so there were a limited number of people who could help. At the same time, translators were faced with having to find terminology that didn't already exist in their language. And they had to think about, should they turn to the community for it? Should they just come up with a term that and hope that people understand it? For some, they turned to the community, and some of the communities are still talking about this 4 months later as to what certain terms are, like hand sanitizer. And professional translators were not particularly happy with us translating stuff for free because it was taking paid jobs away from smaller communities, and that's a big problem. Next slide, please. And so I believe before the next epidemic or pandemic hits, that Wikimedians need to come together and sit down and decide what they're going to do in order to react faster to the next one. Because it took a long time for some communities to react. Not everybody was very quick at it. Netha's work was really good, and I hope that continues also in the next pandemic or next epidemic. For graphic design, it'd be really nice to have a font that works with all the languages. The font used in the infographics didn't actually work with Skolt Sami, so it's just missing all the interesting letters out of the infographic, so we can't actually use it. And also the fonts used by Wikimedia projects in general don't work with Skolt Sami, which is a problem. The last problem that I'll talk about is that we need more people. We need everybody to come together and help, because Susanna did an incredible amount of work over an incredibly long period of time by herself with the graphics. There weren't enough people that could help her with them. And we really need more people. And that's my talk. Thank you for listening. And
thank you so much.
I think we're on to Subha. Yeah.
Yes.
Thank you.
Thank you so much. That's a lot of work, I must say, and congratulations to you and Susanna for doing a lot of heavy lifting throughout the entire project.
I'm just going to jump in, Subhashish, apologies, before you start. Just to say sorry about the spam on the YouTube comments. I believe we fixed it in that now all the comments have to go through moderation, so they might come in a bit slower, but hopefully we won't have any more spam. Sorry about that. Over to you.
No problem. Sorry for the hiccup. Hi, everyone. My name is Subhashish. I'm from the Odia Wikimedians user group. And just to give a context, Odisha is located in the eastern part of India, which is green at this moment on this map. Next slide, please. So, as you can see, and I've written that in bold, the state has a long coastline, and there are a lot of migrations that has happened in the recent past, particularly to the states that I have put names for. When the COVID-19 pandemic started, a lot of people started to come back to their home because it wasn't safe. Sometimes the employers wouldn't allow people to stay and work, and they wouldn't provide them salaries and so on. Majority of the people that lived outside the province are migrant workers, and of course they faced a lot of socio-economic challenge there in the places where they lived. And when the reverse migration started, the COVID-19 positive cases also started to grow really fast. I mean, if you look at the statistics of India at this moment, it's 793,000 positive cases with 21,000 deaths, and Odisha, which is a smaller state, a really tiny state with about 45 million people, which is not tiny in the standards of the rest of the world, has many positive cases as well. Next slide, please. Right now, as we speak, there are 11,956 positive cases with a very good recovery rate, of course, but also 56 plus deaths. And the Odia Wikipedia community is pretty small in terms of the number of active contributors. There are about 21 or so activators, and out of them, about 7 are fairly active, particularly in the topics related to COVID-19. So in terms of number of articles, we don't have many articles, but there are 6 extremely detailed articles, and one of the articles is about 6,000 words, which is one of the longest articles on the project itself. And majority of the portion of that particular article is written by someone who has great details of knowledge in law, and we're really lucky to have a contributor like him. But there is also a doctor I'm going to talk about a little bit later, and he also has contributed a lot to a lot of COVID-19 related articles, and those are very high quality articles because he's a physician by profession, and he's now retired, and he has been devoting a lot of his personal time to Wikipedia. Something really valuable work has happened as well. We have had a collaboration with the local government. Next slide, please. So this is the COVID dashboard by the government, and this, of course, was created around the time when the COVID-19 positive cases start to emerge. And Shailesh Patnaik, who is one of the active editors of the community, talked to the government, and I mean, there has been sort of a relationship with the government for a long time, and the government agreed, and they released the whole dashboard under a CC BY 4.0 license. And that was really helpful because that helped us to extract a lot of information from the portal. Next slide, please. And as you could see, probably the text is pretty small, but majority of the content in this particular category come from the contributions by the government. And next slide, please. Much before all these things happened, the collaboration with the government started a few years back. But in last year, the government released a bunch of dictionaries that they published, and since then they have been releasing a lot of their websites, relicensing a lot of their websites under CC BY 4.0 license, and that allows us to extract a lot of pictures and videos and that kind of media files from their websites. Next slide, please. And as we saw this opportunity around last year, there was a tool that was created by one of the Odia Wikipedians. And this tool allows anyone to upload pictures from Twitter, specific Twitter accounts that are relicensed under CC licenses. So one can easily select the Twitter handle, and then they can upload the picture or video on Commons. So the Chief Minister's Twitter handle and the official Twitter handle of the government, the health department's handle, and a bunch of other Twitter handles that are operated by the government constantly release pictures, videos, notifications, announcements on their social media channels. And we were able to import all of those media files on Wikimedia Commons. And that was a great opportunity that we didn't expect COVID-19 would come. But COVID-19 happened, and unfortunately, there wasn't much opportunity for the community to go out or do anything or to get information, to get media files. Next slide, please. And as I was referring to a doctor that we have in the community, his name is Subhash Chandra Raut, and he has been active on Wikimedia projects for the last few years. He's been a very passionate Wikipedia editor, and his contributions are mostly in the medical science domain, and he has been contributing a lot of content about COVID-19. He also has made the Video Wiki videos. So this is a snapshot of one of the articles where he explains, and this is very useful for accessibility. A lot of communities that might have people that won't be able to read would be able to listen to audio and audiovisual content. So this is something that a lot of communities can also invest if they have dedicated community members like Subhashish. So that sort of brings me to the end of my presentation, and I just want to highlight that the issues that we faced are sort of shared issues with many other communities. There are less number of people always on Wikimedia projects, and ours is no different. We only have 21 active editors, for instance, and out of them, almost 1/3 is active on the COVID-19 related content. And there's a lot of work that needs to be done. A lot of new content that is created has spelling mistake, for example. So that is one big sort of issue at this moment. And the others being that there's only one subject expert, and there's a lot of work, there's a lot of hard work to do, particularly in this area. We also don't have the terminology for COVID-19 or medical science generally standardized. So a lot of time there is this dilemma that whether we would use a transliterated term or will we translate a term in Odia, and that continues to exist. But some of the good opportunities that we had was the collaboration with the government, a good relationship with them, and then them agreeing to release their content right around the time when we really needed them. The tool was built not too long ago before COVID-19 happened, and it just was the right tool to be used for this particular time. So that's where I finished my presentation, and it would be Netha to talk more details about many of the Indian languages and largely how the COVID-19 task force is doing. Over to you, Netha.
Thank you very much, Shubha. And it's very interesting how you managed to create partnerships with the government even before the pandemic, and how the collaboration helped later on during the pandemic that you could import a lot of media and other files to Wikimedia Commons and eventually to Wikipedia. That's really interesting. And I shall go to my own presentation about the COVID-19 translation initiatives. So I am a Wikimedian interested in medicine, and I also work with translations. So here I shall give a short overview about some of the COVID-19 translation initiatives that have happened in Wikimedia projects, apart from those we have discussed from other people's presentations today. In particular, I shall speak about the COVID-19 Translation Task Force, the Swasta initiative, and the initiative called COVID-19 in Indian languages. So one of the main problems that many countries are facing today is misinformation. Misinformation has become so rampant in the context of COVID-19 that the World Health Organization called it an infodemic. So these translation initiatives were launched with a common goal of providing updated and reliable information in as many languages as possible. So the article about the coronavirus pandemic is now present in 131 language editions of Wikipedia. This is a very big accomplishment, and this has happened due to the efforts of thousands of Wikipedia editors who write articles in these languages. But then Wikipedia has over 300 language editions. So this means that the article does not exist in more than half of the all language editions, and most often, unfortunately, in languages spoken by minorities. So if you take a random language that is spoken by minorities, it's highly likely that that Wikipedia does not have an article about COVID-19. So I was thinking about why this would happen. So the reason why the article doesn't exist in some languages is probably because that the language community does not have the resources to create a new article from scratch, because the community is so small. Like Shubha mentioned previously, some communities are very small and they may not have an expert who know about COVID-19, so they cannot create a new article from scratch. Or they may not have sufficient references available in their language. because most scientific communication happens in English, German, and other big languages. It may be possible that there are not enough references in these small languages, or because they do not have experts in the subject area of COVID-19. So I was thinking what we can do to counter this problem. So we started a translation task force, which was started as a part of WikiProject COVID-19 on the English language Wikipedia. So WikiProject COVID-19 was a project which we put together somewhere around March 2020 to work together to assess articles related to COVID-19, to find missing topics, to collect all the sources and resources related to COVID-19. So the Translation Task Force is an arm of the COVID-19 Wiki project, and the goal of the task force is to create shorter versions of important articles related to COVID-19. So these articles are in a way summarized version of the long article in English. And these are proofread by an expert, and all references are cross-checked for authenticity in order to make sure that they are sufficiently reliable. And they also have to be written in a culturally neutral way, because we see that on the English language Wikipedia, we mostly have Anglo-centric content. So we have to write it in a way that it's appropriate for all cultures. We should take care not to include too much of Western specific content as well. And these articles should also be time proofed in a way that the editors don't need to update the article every now and then, but it's enough to update it once in a month or so. We know that the situation related to COVID-19 is changing day by day and minute by minute. And small languages do not have the resources to come up with that pace. So if we create a time-proofed version that could maybe updated in a month, once in a month or so, that would be good. And there is an inbuilt translation tool in Wikipedia that helps translation from one language to another. And Wikipedia language editions without an article on COVID-19 can make use of these short versions to translate content. And the Translation Task Force has a short version and a slightly longer version of important COVID-19 related articles on that page. And like all other speakers mentioned here, this project also needs more people, particularly experts, to create these short English versions which are ready for translation. So if you are someone who is interested in the project, please sign up on the project page, which is given in the slide here. And you can also write to me directly if that is how you feel best. Yes, so we need really many more people. There is another initiative called Swasta. Swasta is the Sanskrit word for health, and it stands for Special Wikipedia Awareness Scheme for the Healthcare Affiliates. Swasta aims at increasing the reliability of Wikipedia articles, particularly at countering misinformation in Indian languages. In the context of COVID-19, they are involved in watching Wikipedia pages in Indian languages to find inaccuracies and misinformation present in them. So when an editor finds misinformation, they can point it out to an expert, and based on the expert advice, misinformation can be corrected. So in that way, the expert who is not familiar with Wikipedia doesn't have to edit, and the editor can do that work. So the members of the Swasta community include experts in medicine, translators, and regular Wikipedia editors interested in helping out with Indian languages. There is a third wiki project called COVID-19 in Indian languages on MetaWiki. This is a pan-India initiative to coordinate the efforts to share and localize materials required for creating quality content in Indian languages. So for example, most images related to COVID-19 on Wikimedia Commons contains labels or text in English. And COVID-19 in Indian languages project is involved in localizing such images, graphics, labels, and charts to Indian languages. They are also involved in assessing the quality of COVID-19 related articles in all Indian languages. And most of the like charts and diagrams, because they are in English, they cannot be made use in many of these Indian languages. And this is one of the problems that the Wikimedia community should address. While we are mostly aware of the gap between English and non-English languages in terms of content, we rarely talk about the image gap And I think one of the work that Kimberli is doing with regards to this about localizing the images is very important, especially in the context of COVID-19, because the concepts like social distancing and how far and wide the disease can spread, these are very difficult to explain with words, but with images, they are even more obvious. So I think it's important that we use technology such as Wikidata to illustrate images in as many languages as possible. So these are some of the translation and localization initiatives that I am aware of. And if you have been doing something similar surrounding COVID-19, please let us know during the question and answer session, which will come after the panel discussion. I think I can just move to the panel discussion now. Yes, Subhashish, over to you.
Thank you, Netha. I have a question for you, and that's a lot of work. I should say that managing so many communities and talking to people on a regular basis, that's a lot of work. And thank you and all the other friends who are actively contributing. I have a question for you, and that is about any plans to send automated notifications to people, community members that are translating or creating new articles related to COVID-19 on their own languages, because the information is changing so fast that it's sometimes not easy, and editors might not remember to do that on a regular basis. Because for me, as an editor, I would create an article and I'd leave that for some time, and I'll come back to that later. So is there any plan, or are there something that you're planning to do?
Right now, I only know about the plans of the translation task force, and we have not thought about that. And I think it's a very interesting perspective. What you said is very correct, because people do not edit in long bouts. They may stop and then they may come back in between. So it's a good idea to send a reminder at least to some of the active editors who have edited pages related to COVID-19 before. So I think it's a very good idea that we should consider when it comes to translation, not only translation, but also in other aspects as well. Yeah, that's a good suggestion, I would say.
Great. Thank you, Netha. I have a question for you, Kim. You work with a lot of languages that might not have a very good presence on the internet, and that also would reflect on the Wikipedia, that they wouldn't have articles about, say, virus, or even if they have articles about a virus, that's a fairly large topic. And there are many articles that can be created under that category. So how do you deal with that situation with the languages that you work with?
Well, with the languages I work with, we had to actually create the articles for viruses and things like that before we could start translating about COVID-19. Actually, there's a whole structure. The categories, everything is missing. So it's not just a matter of translating an article about COVID-19. It's translating about viruses and translating about pandemics and epidemics and on and on and on. And it's actually this big, huge rabbit hole, which you can just kind of disappear into. But the important part is to try and remember that the information needs to get out there as soon as possible. And so, like with the Northern Sami one, I think we started with the COVID-19 article first and then worked back from there. And we still have a lot to go, actually. In the Inari Sami community, they actually started with the pandemic and epidemic, because in the 1920s, there was an epidemic of the Spanish flu that wiped out most of the community, like 10% of the community. So that was their starting point, where they started from. Different communities will have different places where they start from.
All right. Yeah, thank you so much for that. And the other thing that I want to ask you is that with a lot of indigenous communities, it's also about the community effort, the community working together, and there are elders in the community that always advise on things. They might not be experts on COVID-19, but they're experts in the community and how a community functions. And that's a very tricky balance. How do you deal with something like that?
We've had the fortunate fortunate in the Sami communities that the people that are the elders in the community are very knowledgeable about also viruses and things like that. So we haven't had a big problem with it, but some of the communities have had problems with it, that there's been misinformation spread by the elders as to what can be done in these kind of cases. And I don't know how they've solved that issue at all. I am sorry. With some of the things when we were localizing things, we also had we localized them so that they were like, this is the community coming together to work together to save our elders from the pandemic. So that way the social distancing was that don't go visit your elders, save your elders type of message, which worked a lot better than just saying stand 2 meters apart from each other.
Yeah. We also have a question, and this is a question for any of you to pick up and answer. Netha, Iñaki, Kim, all of you can jump in and answer. The question came, I think, on YouTube. It's about should there be some retro changes to the various national health authorities regarding all the work, and even if it's just to get funding for the local Wikimedia group? Do any of you have any inputs or comments here? You could just unmute.
So,
okay.
Yeah, for the Basque Wikimedia's user group, we have actually, like on the website, we have the Basque Wikimedia's user group, but then very associated to it, there is the education program. The education program receives allowance from the Basque autonomous government. So it could be thought that it is things are done within that context, within that framework. Actually, this was not done within that framework because it was completely volunteered. But I don't know to what extent, because they were actually issuing guidelines in Basque, but they were related to the Basque autonomous government, not for all the Basque speaking community. But anyway, so we have the Basque education program, and there are allowance we are receiving. But actually, all this work was done basically related to the media, with collecting from the local media outlets, and on the one side, and on the other side, working on the meta in order to translate these graphics and everything was on a volunteering basis. I don't know if I would dare now go just request money for that, if that is what the sense of your question is. I cannot think of that here right now, but perhaps Netha or Kimberli have other ideas.
Thank you, Iñaki.
I think it would be good, like, for the next time that we have some group in place, that we have some way of getting some kind of funding in a quick manner, because after the fact we can't go, hey, you got to pay us for this stuff. But it would be good that there's something in place that we could work with the government agencies to get the stuff out there.
Yes. Yeah.
The Swedish language Wikimedia community, the Wikimedia Sweden, the affiliate from Sweden, they were successful in bringing some posters in 24 languages to Wikimedia Commons. So these were the posters circulated by the government for giving awareness against COVID-19 and the preventive measures for the disease. So we did not get anything like solid funding, but we got some support in terms of media from the Public Health Agency.
And the Northern Sami Wikipedia thanks you. We're using it in our article.
That's great.
Yeah.
And I think one of the things that communities also need to keep in mind that the governments are not aware of the licenses all the time. So the posters that Netha was mentioning about, there was a licensing issue because the government released that under a specific license that they have been releasing their documents. And that wasn't very compatible with the Wikimedia project. So I think some of the posters were taken down from Commons. And that's another different kind of challenge, because standards and licensing, those things need to be clarified beforehand, because the government won't have time to discuss those things during a pandemic. That will be the least of their priorities. I have a question for Iñaki. A lot of times during an emergency like a pandemic, communities don't have enough time to translate everything manually. When it comes to translating long articles, and you can't really skip portions of an article when the whole article is so important. And do you use machine translation or something like that that could make the job of an editor faster? Unmute yourself, Iñaki.
Sure. Yes. We have content translation application, and that work has been tested since 2 years ago, 1 year ago. It is actually called the machine. We see, but it was not so good. Nowadays, translation machines and devices are being developed very quickly for the Basque context, with autonomous government support and the university, the public university, and it is called neural translation. Because we have problems related to the structure of the language, and since we are an isolate in terms of genealogy, linguistic genealogy, and it's not like translating from Spanish to Catalan or from Catalan to Spanish. And nowadays we are trying to implement this translation, automated translation by means of new devices, but not quite yet. But we are looking forward to it. We are working a lot on this.
Thank you, Iñaki. And thank you so much. That sort of brings us to the end of this panel. I'm hoping to connect with you all later, but I'm hoping that our audience got some idea, and probably some of the communities will start working. So I won't speak for any longer. I'll pass to Daria for sharing some of the information that would be useful for the audience for the next session.
Yes, about what's happening next. So just quickly, first of all, apologies everybody for the spam in the chat. We've now found all the functions that we need, so we should be okay going forward. And also, I think we have worked out how to disable live chat in replay, so the recording of the video should be without the chat, which I think is going to be better for this video. But in terms of the panel, thank you so much for sharing your experiences in this difficult really time, and how your communities have responded. Hopefully it served as a bit of inspiration, and also just helped us understand how this context works out in many different contexts. So thank you again for collaborating with us on this panel. And for everybody watching, we now have just 10 minutes before the next and last presentation of the conference, the search support for minority languages. Please use the 10 minutes that you have to have a stretch, get up from your desk, maybe get a drink, and see you at the last session, which will also include our closing remarks. So hope to see you all there. Thank you again for the panel.
Thank you so much,
you.
Daria. Thank you, Richard. Bye.
Thank you. Bye.
Thank you.